Kogi State Government, under its Health Insurance Agency, has vowed to educate all informal sectors of over 90% of the population on gains attached to the agency if captured. The Executive Secretary to the agency, Dr. Aledare Adekunle, during a meeting of all communication specialists in the state to map out ways to reach the informal group of persons, better promised to engage media and other relevant agencies like National Orientation Agency to achieve its objectives. The meeting attracted religious leaders, traditional rulers, NGOs, and retired permanent secretaries. Our reporter has the rest of the story. Let's join her.
The meeting was a time out for communication specialists to deliberate on how to reach out to the informal people such as the artisans, market men and women, farmers and others who were described to be over 90% population and spread across the 21 local government areas of the state. During the discussion and mapping out strategies to reach out to them in order to benefit immensely from the laudable health insurance for all citizens by the government, the representatives of National Orientation Agency, NGOs, religious bodies, retired permanent secretaries, traditional rulers, market women, and host of others expressed their concern.
The agency has staff in the local government areas, and those staff speak the language of the people. We don't take an Igala man to Okene, for instance. All Igala people that work in NOA work in Kogi East. And that is how it is all over the country where we have all the local government areas in Nigeria. So in our own case, it is not an exception. We want to assure you that if given the task, and if we meet and discuss, and we have all our officers here, I wish I had known before now, the 21 local government officers, community orientation and mobilization officers would have been here to feed from what you are about to do, and the matter we are talking about will be settled.
We market women. If you want this enrollment to be successful, we have to synthesize them, because many market women, they don't understand English. So we have to use their languages. We use Igbo, we use Yoruba, any language that you know we can use them. We have a successful enrollment.
Provide the necessary support and ensure that from our own end, because the informal sector is a very complex sector to approach, and a whole lot needed to be done.
Everybody knows what is informal. The civil servants are very easy. They have a salary. They deduct from source. The informal sectors, some of them go to work. They hardly come home with 500 naira in a day.
I'm a retired permanent secretary, and concern is already on for retired permanent secretary at this. As I'm speaking to you now, by the next week, we'll start capturing the retirees, because already been given for that is taken care of. Thank you.
Can have a very fantastic network throughout the whole 21 local government of the state, and we are going to encourage our members to make sure the partnership with this program.
For this umbrella traditional institution of Kogi State, we appreciate this, and we believe definitely we must. I use the word must because we are traditional rulers. We lead the living.
Before the program started, these enlightenment programs was not sufficient. There was no sufficient enlightenment program for this program to succeed. And that is why so many civil servants don't even care that this program is in existence, and it's for them. And their money are being deducted. So if we are going to the non-formal sector, you can imagine what it's going to look like if we don't have massive awareness campaign at the local level. And on this note, I want to assure you that Jamaat Nasrul Islam is always having a robust collaboration and support for both the Ministry of Health, the Primary Healthcare Development Agency, and now the agency here. My brother is the Executive Secretary, so I want to see him succeed.
We appeal sincerely that your commitment, your resilience should be kept up, and we are going to give you that support to make you to succeed, because a healthy man is a wealthy man. This is what and Islam is emphasizing on making sure that there should be health. You see, there are some of us that argue they don't need drugs. We tell them we need drugs because the Prophet sallallahu alaihi wasallam was the best doctor on the surface of the earth. And that is why if you go to a compendium called Tib Nabawi, that is prophetic medicine, you will find what it is there, that Islam encourages medicine.
They also expressed gratitude to the state governor who drives joy in ensuring that the people are well and sound.
We have discovered that you have even gone a little above NHIS, which is responsible for caring for the federal civil servants in the country, and they are making effort to get to the streets. You are going down to the grassroots. Please, a round of applause for them.
What the state government started from Aledare Bello and to the present governor, Alhaji Ododo, they are renovating and even building some primary health care clinics. And this one will be another good thing being added to our lives.
In reaction, the Executive Secretary of the State Health Insurance Agency, Dr. Adekunle, raised his concern on why many still lack understanding of the agency, hence bringing experts in various disciplines together to navigate the direction the agency must take to achieve its vision and mission in the state.
More than 95% of the population are in the informal sector. For a while, we've been enrolling in the formal sector, which constitutes about 5%. So we have the majority of the population in the informal sector that are not yet covered. Because the mandate we have as Kogi State Health Insurance Agency is to provide equitable access to quality healthcare services to all residents of Kogi State. So we don't want to leave anyone behind. Every other person that is self-employed, unemployed, or in the informal sector population must be brought on board. And that's why we're having this meeting. And I'm glad we have the National Orientation Agency here with us and other civil society organizations, all the media outfits.
He appreciated the immediate past Governor Yaya Bello, who launched the agency, and the present administration of Governor Ahmed Usman Ododo for the continuity and ensuring no one is left uncovered on the insurance list in order to enjoy 100% quality health care. To enjoy the full health package of the agency, it is expected that each citizen shall pay an annual premium of 15,000 naira. Faith Adike reporting for MSC TV.